Hello everyone, welcome to today's webinar all about 3D Matrix, which is one of our formulations designed for strong joints and healthy skin. My name is Enver Kelesade. I am a registered clinical nutritionist and a doctoral researcher at the University of Roehampton, London in the field of gut health, immunity and metabolic disorders. The 3D matrix is a unique multi-complex formulation manufactured using innovative 3D matrix technology, which allows delivery of useful substances, chondroprotectors, amino acids, and antioxidants help strengthen joints, develop collagen, strengthen blood vessels, and protect our body from damage of the oxidative processes. Thanks to its synergistic effect, the ingredients in the formulation, basically the one component of the complex, will reinforces another, so they work in harmony synergistically. The 3D matrix is needed for strengthening the skin turgor, strengthening the joints, for elasticity and strengthening of the connective fabrics, strengthening the vascular walls, and for individuals who experience high exercise load, and recommended for improving brain function and increased immunity. The composition of the 3D matrix is very rich. We have chondroitin sulfate and glucosamine sulfate, which contribute to the strengthening joints and prevention of osteoporosis. We have osteo, which is a bioactive protein, which slows chondroprotective properties and significantly enhances the effectiveness of chondroitin and glucosamine through synergistic effects. Calcium in the chelated form in our formulation is an indispensable for building bone tissue and maintaining the youthful skin. Dihydrocortisone in our formulation, which is found in the liposomal form, and resveratrol are the two most powerful antioxidants derived from Siberian larch and grape seeds, providing the best protection against oxidative destruction by the free radicals around us. We have vitamins such as B, C, and H in our formulation, which are not synthesized by the body, and we need to get them from our diet, basically what we eat, to help maintain the beauty of the skin, hair, and nails. We have L-lysine, L-glycine, and L-proline, which are key amino acids that participate in the formation of connective tissues and synthesis of collagen. We have ginkgo biloba, which enhances brain function, improves memory, and increases concentration. We have citrate copper, which helps to improve elasticity of the blood vessel walls, pulmonary alveoli, as well as increases the body's resistance to various infectious diseases. We have rutin, which is also known as vitamin P, is indispensable for capillaries as it promotes the strengthening of the retinal blood vessel walls and capillary walls, making them less brittle. And doing that, it also boosts your immunity. Besides, we have hesperidin, which is a bioflavonoid. It normalizes hormone balance, prevents obesity, supports the liver, and reduces wrinkles, increasing skin elasticity. Hesperidin also protects the heart and the brain from negative influences and helps to protect the structures of the brain. And while it has an antioxidant properties besides as well. Osteoarthritis is a chronic progressive joint disease in which articular cartilage, subcutaneous bone, and periarticular tissues, ligaments, capsules, synovial membrane, and muscles are involved in the pathogenical progresses. Basically, the osteoarthritis we can divide into the several stages. Let's say the stage 1 is basically the doctors observe a suspicion. In stage 2, you can see a minor damage. And stage 3, this damage is further progresses, and we can refer as a mild damage. And the fourth stage, we have like a moderate damage, we can see that significant gaps are unfortunately starting to develop. The most common localization, very localized, of the osteoarthritis is the hips, elbow joints, shoulder joints, joints of the hand, and intervertebral joints are affected as like localizing the osteoarthritis. The risk factors for the development of osteoarthritis is such as trauma, heavy load, obesity, based like carrying excessive amounts of weight around the abdominal area, the increased age, gender, like being females are significantly more prevalent among the females, the concomitant pathology, basically like having multiple conditions at the same time. We have congenital features, heredity, and professional sports, as I mentioned at the beginning of today's webinar, like these increased exercise loads are risk factors for the development of osteoarthritis. I mentioned osteoarthritis because it is one of the unfortunately significant conditions in the worldwide affecting many of individuals, and we performed a clinical trial among the osteoarthritis individuals and see the effectiveness of the 3D matrix. The objectives and aim of the clinical trial that we performed was to evaluate the efficiency of the 3D matrix complex application using instrumental and laboratory methods of research in patients of the main clinical group. The second aim was to evaluate clinical data using questionnaires and, of course, the blood biochemical parameters of patients before the start of administration and 30 days after the application of 3D matrix. On the basis of the obtained data, our third aim was to develop the optimal dosage of 3D matrix for use in rehabilitation after injuries and the surgical interventions on the bone and joint system. So, for doing this trial, we included in our study patients aged 25 to 65 years old from both sexes, so both males and females were involved in the study with various clinical manifestations of tissue regenerative activity, such as like bone tissue repair, like bone fractures, and regeneration after surgical interventions on the background, like having the osteoarthritis, and patients who signed consent to participate in the study and were given detailed information about the nature study are only included in our study. We excluded the individuals from our study if they receive like a treatment with other drugs during and for 2 months prior registering the study. We excluded the individuals with the presence of decompensated and unstable concomitant diseases of the heart, liver, kidneys, endocrine system, oncological diseases, diabetes mellitus, and systemic collagenesis. We also excluded participation in any other trial within the last 3 months and failure to attend a follow-up examination after 30 days of taking 3D matrix. So any of these individuals are within these categories are excluded from our clinical trial. The 3D matrix that people administered basically received during the treatment, basically in the clinical trial, was the formulation exactly as I mentioned previously. We have chondroitin and glucosamine, we have hesperidine, dihydroxyzine in liposomal form, we have resveratrol, copper citrate, ginkgo biloba, amino acids such as L-lysine, L-glycine, L-proline, vitamins B, C, and H, rutin, and osteo were in our formulation of the 3D matrix. So the eligible individuals in our study received intravenously 3 times a day with meals drinking with 100 milliliters of water. You can see the results from here. Before taking 3D matrix, you can see on the left-hand side of the column with turquoise color, 83% severe pain people were feeling at the beginning before taking the 3D matrix. But just after 30 days of taking 3D Matrix 3 times a day, this severe pain reduced significantly to 23%. You can see on the right hand side of the column. Like in the second marker, we had this graph was demonstrating like the reduction in the severity of like dizziness. How you can see that was like, you can see on the left hand side of the graph, the red color, we had like 83% severe dizziness score reported before taking the 3D Matrix, and it's just like reduced after taking 30 days of 3D Matrix down to only 3%. When we look at our next marker, which is drowsiness, on the left hand side with the yellow color, you can see that the drowsiness levels of the severe drowsiness were 90%, and after taking 3D Matrix for only 30 days, this was reduced down to 23%. And here we can see the Western Ontario and Macmaster University's osteoarthritis index. Basically, like it's it's a WOMAC index, which is widely used as a set of like standard questionnaires used by health professionals to evaluate the condition of patients with osteoarthritis of the knee and hip. It assesses, you can see that like the pain, stiffness, and physical functioning of the joints. And when we look at this index, before taking the 3D Matrix, we had a very high scores of like the WOMAC, stiffness, pain, FN, and when we administer the individuals who registered our clinical trial, after 30 days of taking 3D Matrix, there were significant reductions in the WOMAC index, FN score, stiffness, and pain. When we look at this graph, although the lines seems a little bit complicated, this graph visualizes for us the lipid peroxidation intensity in our subjects. You can see that in the yellow color, which is like a monoaldehyde, which is produced as a byproduct of the peroxidation of polyunsaturated fatty acids in the body. The elevated, increased levels of monoaldehyde in the body are often considered a marker of like the oxidative stress and lipid peroxidation. When we look at like the first step, before taking the 3D Matrix, in individuals over in the yellow color, over 55 years old, had a significant reduction after 30 days of taking 3D Matrix, and a similar pattern, actually more pronounced, more effect, was observed in the age group 25 to 55 years old with the dark orange color. You can see that there's like a more significant reduction in the age group 25 to 55 years old. And we have left like green and brown colors in our line graph. Basically, low levels of like tocopherol may indicate a deficiency in vitamin E. This can occur in our bodies if you are not getting enough vitamin E from your diet, or if your body is not properly absorbing it. Vitamin E, specifically the alpha tocopherol I am referring here, plays a crucial role in protecting against lipid peroxidation. It acts as an antioxidant by scavenging neutralizing free radicals, thereby preventing the initiation and propagation of like the lipid peroxidation reactions. And we can see that the tocopherol content was a little increased in the 55 years old group, but the most significant effect was seen was in the age group to 25 to 55 years old in the tocopherol content, which was a significant increase. Our next markers were about the lipid graph in here. We can see that on the left-hand side, we categorized individuals over 55 years old and between 22 to 55 years old in several lipid parameters. When you see at the first place, we have LDL, which refers like a low-density lipoprotein protein, which is in public known as like a bad cholesterol. We can see that over 55 years old, it's reduced from 4.2 down to 4.15. And among the age group 22 to 55 years old, we see more pronounced effect from 4.42 to reduce down to 3.95. And when we look at the HDL, which is like a high density lipoprotein cholesterol, which also known as like the good cholesterol in the public, is in over 55 years old age group, it's increased from 1.07 up to 1.1. And the more effect, the better effect was seen in the age group 22 to 55 from 0.87 up to 0.98. And when we look at the total cholesterol in over 55 years old group, there was a significant reduction from 5.62 down to 5.02. And in the age group 22 to 50 years old, we had a massive drop from 6.21 down to 5.01. And here you can see that what happened in the clinical trial. You can see there was like a lot of cracks and the gaps between the osteoarthritis and osteoporosis individuals. And after taking the glucosamine chondroitin, it fixes these gaps and it leads to increased recovery progresses as it fills these gaps. And here we have more parameters that we tested on the individuals who participated in our study. You can see on the left-hand side several indicators. The first one, LEF, which refers to lung expiratory flow. The second one was the forced gas expiratory flow, referred as FGEFF. And we have SPF, which refers to specific airway resistance. These are the indicators of external respiratory function. And when we look at our graph, like before and after taking 3D matrix, there were like statistically significant improvements in the vital capacity of the lungs of the individuals who participated this clinical trial just after taking 3D matrix in 30 days. And here I have made some combinations for you that you can combine from our product range. So if you like to get further effect because of the urprin's anti-inflammatory properties, and that will make like synergistic effect when combining the urprin with 3D matrix, this will lead to improved joint comfort and mobility. If you combine the 3D matrix with Infladel, thanks to its anti-inflammatory properties of Infladel, you will have more pronounced effects in relieving like inflammation and the pain syndrome you will observe if you have any. If you combine 3D matrix with vitamin C, as vitamin C plays like a crucial role in the synthesis of collagen, which is a protein that is a major component of the cartilage, tendons, ligaments, and other connective tissues. And as vitamin C is also a powerful antioxidant that helps to protect cells from damage caused by free radicals, and which also supports the reducing of the inflammation and will further support your joint health. And in addition, vitamin C can help you to enhance the absorption of glucosamine in the body. You can further combine with alpha omega Q10, which have anti-inflammatory and synergistic effects that can help alleviate joint pain and support joint comfort, mobility, and overall joint function. You can also combine the 3D matrix with vitamin D3, which have immunomodulatory and synergistic effects in this formulation, which can help you to reduce inflammation, support joint health, and enhance the effectiveness of glucosamine and chondroitin. So depends on your personal needs. You can make several combinations that further enhance the benefits of this product. So just to recap and summarize what I have mentioned today about 3D matrix, it can be used in wide range of applications. So it can be used to improve the conditions of your skin, hair, and nails. This is very beneficial for patients during the rehabilitation period following surgical interventions, and for individuals who experience some trauma, basically like damage and external damage, and for individuals experiencing high physical exertion to enhance their athletic performance. So the advantages of our 3D matrix is that you will going to get 4 effects in one bottle. It is strengthening of the joints and blood vessels, your youthfulness of the brain and your skin. And as I mentioned from the early beginning of today's webinar, these ingredients in the formulation are having like synergistic effect. So one component of the complex will reinforces another to give you the maximum, the best from this product. I would like to thank you very much for listening me today. It's all about 3D matrix. Wish you a nice and healthy day. Stay tuned.